You know that feeling, right? That very specific 7 a.m. kind of panic. You open your eyes, you blink, you rub them, you blink again, and the world just isn't snapping into focus. Well, let's dive into that really common and, let's be honest, really frustrating experience.
Yeah, if that quote feels familiar, then you are in exactly the right place. That blurry, smeared, out of focus feeling is what we're going to tackle today. Most of the time, it's totally harmless, but man, it is always unsettling.
So, in this quick guide, we're going to give you two things, and we're going to do it fast. First, a safety check to figure out if this is actually an emergency, and second, some clear steps you can take right now to start seeing clearly. Okay, before we even try to figure out why your vision is blurry, we have to make sure you're safe. This is, without a doubt, the most important part, so let's get right to it. This is the one question you have to answer before you do anything else. So just take a breath, and let's go through this calmly and clearly. I love this quote because it's the perfect way to think about this. Most of the time, that morning blur is just the toast. It's annoying, but it's harmless. But we just can't afford to ignore that small chance that it's the wiring. A sign of something much more serious. All right, look at this list, and I mean really look at it. If you are experiencing any of these things right now, I'm talking severe pain, a sudden vision change in just one eye, or especially that curtain-like shadow, please stop this and seek urgent medical care immediately. Seriously. Okay, deep breath. If you're still with me, that's fantastic news. It means we're almost certainly dealing with one of the common non-emergency culprits. So let's shift gears and decode what your eyes are trying to tell you. This chart right here simplifies things beautifully. Most morning blur is going to fall into one of these three lanes. Does it feel gritty, like there's sand in your eye? That's pointing to dry eye. Does your contact lens feel kind of tacky or stuck? Well, that's your clue. And if your eyes are puffy and itchy, odds are you're in allergy territory. So, what is this desert corneal morning all about? Well, when you sleep, you just don't blink as much. And if you've got a fan blowing on you or the air is just dry, your tear film can literally evaporate, leaving the surface of your eye all uneven. It's like trying to look through a wavy piece of glass.
For all my contact lens wearers out there, this is a big one. Even taking a short nap can be enough time for your lenses to dry out. And when they do, they start acting like a little sponge, pulling moisture from your eye. That's what makes your vision go all soft and out of focus.
And finally, we've got the puffy lid blur. Think about it. You spend hours with your face buried in a pillow that could be holding on to dust, pollen, or pet dander. Your body reacts by releasing histamines, and that causes that classic puffiness and watery irritation that messes with your vision. Okay, now that we've kind of figured out who the likely suspects are, let's get to the good stuff. What you can do about it right now, in the next minute. It all boils down to this super simple three-step process. First, and this is the most important one, hands off. I know it's tempting to rub your eyes, but it just makes everything worse. Second, get some preservative-free artificial tears in there and blink slowly. And third, grab a compress. Go with warm if it feels dry and gritty, and go with cool if it feels itchy and puffy. Now, if you are wearing contacts, there is one golden rule that beats everything else. Get them out. Remove them first. Don't try to blink through it. Don't just add more drops. The very first step is always to take the lenses out. This story really drives the point home. Someone took a nap in an airport and woke up to a world that looked like it was filmed through wax paper. The panic was real. But you know what the solution was? Just getting to a bathroom, washing their hands, and removing the variable, the contact lenses. Within just a few minutes, everything was back to normal. Awesome. So now you've got a plan for instant relief. But let's talk about prevention. How can we set ourselves up tonight to wake up to a clearer morning tomorrow? This is your 2-minute nightly investment that's going to have a huge morning payoff. It's so easy. Just wash your face, maybe use a warm compress if you know you get dry eyes, gently wipe away any crusting, and then finish with a good lubricating drop or gel right before you hit the lights. And sometimes, it's the smallest changes that make the biggest difference. That fan you love having on at night, just angle it away from your face. Those get the red out drops, you're way better off swapping them for simple, preservative-free lubricating tears. These little shifts can have a massive impact. So here's your main takeaway, your mission if you choose to accept it. For the next 7 days, I want you to become a little detective. That's really all it takes to gather enough data to see what's going on. And don't worry, this isn't some big homework assignment. It literally takes 30 seconds. Just jot down these 4 things. How long did the blur last? Was it one eye or both? Did you fall asleep with your contacts in? And was a fan or a heater running? That's it. And that little bit of info is pure gold if you do end up needing to see a doctor.
Look, the bottom line is you don't have to just guess anymore. By taking these simple, safe steps and just paying attention for 1 week, you can go from that morning panic to morning clarity. You can solve this mystery yourself. So the only question left is, what will your 7-day log reveal?